What is RCT? What is the procedure of RCT? When the patient needs the RCT? If you are the one having these queries, then give your few minutes to this video. I am Dr. Ziaur Rahman, a dental surgeon. Today, we will be discussing about root canal treatment, which is commonly known as RCT. First and foremost, what is RCT? When the tooth gets untreated for quite a long time, the cavity reaches to the nerve of the canal, which is commonly known as pulp. Once this nerve gets infected, then the patient comes to you with hot and cold sensitivity and with severe pain. Then we have to go for the RCT in order to relieve the pain of the patient. Now comes the procedure of the RCT. In this procedure, we will go for the X-ray. Then we'll check whether the cavity reaches to the pulp or not. If the cavity reaches to the pulp, then definitely we have to go for the RCT. And before starting the RCT, we have to go for the LA, that is local anesthesia, in the tooth in which we are starting the RCT. First of all, we'll do the access opening by the air rotor, and by the air rotor, we'll reaches to the pulp chamber. After reaching to the pulp chamber, then we find the nerve in the tooth. We'll use the hand files to take out the debris and to take out the pulp from the canals. Every tooth has different anatomy. Some tooth have one or two canals, and some have 3 to 4 canals. So we have to find out that how many canals are there in this tooth before starting the RCT. Simultaneously, we have to detect the working length of the canal. For detecting the working length, we need the instrument which is called as apex locator. Apex locator is an instrument which tells us that till where we have to clean the canal. And for cleaning the canal, we need the sodium hypochlorite and normal saline. These are called the irrigants. These are used for the irrigation of the canals. After cleaning the canal with the hand file, then we have to go for the endomotor, which is the latest instrument for the RCT. And this is an instrument in which we use the rotary files. And endomotor reduces the time of the RCT also and gives a very good result after the RCT. And it is far better than the hand file. So we finish the cleaning of the tooth with endomotor. Then we'll go for the last step of the RCT, which is known as obturation. Obturation is the last step of the RCT in which we put the gatta parcha, which is commonly known as GP. Gatta parcha is a biocompatible material which doesn't harms to the patient or to the tooth. So it's widely used for after the RCT in the obturation step. So we'll just seal the gatta parcha in the root canals, and later on we'll give the GIC filling or any other material. We'll fill the tooth, and after the filling, then comes the last step. The obturation is also last step, and but after the RCT, the last step is capping. Capping is the most important step in RCT because if you will not go for the capping in the RCT treated tooth, then the tooth will get fractured in a few months because the masticative forces will break the tooth in few months. So if you want to avoid the extraction of the tooth after RCT, then definitely we have to go for the capping, because capping bears all the load of the masticative forces. If the patient has the cap on the RCT treated tooth, then all the masticative load comes on the cap and the tooth remains safe. I hope that this knowledge might have got some value to you. For any queries, my comment section will always open for you. That's all in this video. For more valuable content, please do subscribe my channel. Thank you very much.